Good morning, it's Dr. Hodges, and this morning I want to talk about bloating. Bloating and belly pain. Bloating and belly pain after surgery. And what does it mean and what do you need to do about it? So, probably one of the most common complaints I might get after a surgery, and actually, it's usually when people are further out from surgery. Now, it's not necessarily in the immediate post-operative period, but patients come in with these vague complaints of crampy abdominal pain, sometimes sharp shooting pain, like a fullness and a bloating after they eat, sometimes pain kind of in their upper abdomen. What does this mean, doc? I don't know. I can't get it to go away. And the reality is that there's kind of a laundry list that I have to go through as a surgeon to kind of tease out what might be happening. First and foremost, when you've had weight loss surgery, number one, you're having changes to the size of your stomach. And number two, you're going to be having changes in your gut hormone and sometimes the way that your gut functions. And all of those can affect gut motility as well as how much you can eat or drink. So the very first thing that I will ask patients is, about how long after you eat are you beginning to experience this pain? If you are starting to have this pain either while you're eating or, within 10 or 15 minutes after you eat, the majority of the time it's because you've either taken too big of a bite, you've eaten too fast, you've eaten while you've drank while you had something to eat, or the food is too dense. So what you're really feeling is this crampy abdominal pain, this stretch on the wall of your stomach. So that's the first thing I usually talk to my patients about. I start asking them, tell me about your breakfast. Tell me about your lunch. Tell me about the snacks that you're eating. And a lot of times, if it's something that's a little ongoing, I'll have my patients keep a food log because, again, I can begin to see a pattern that maybe patients just might not be thinking about. And they might say, oh, wow, I can eat this, but when I eat this, I begin to kind of reproduce those symptoms. So certainly it can be what you're eating and how you're eating. The other thing that it could be is, and I know I've talked about this before, is that I've found that after surgery, sometimes patients have some food intolerances. And again, it's because of the surgery, number one. And then number two, it's also it's a negative impact, but it's a good negative deterrent to keep you on the straight and narrow. And I say that because it's how your body processes carbohydrates. Prior to your surgery, if you are not diabetic, most people can tolerate most carbohydrates. After bariatric surgery, it's not uncommon for people to be much more sensitive to carbohydrates, meaning the amount that they're taking in on any given day or even at any given meal. And certainly, even if your pylori is intact, you can develop dumping syndrome. And what that is you have too much carbohydrate, you have a rush of insulin that comes in that causes a big push of insulin to come out, and you have a drop in your glucose. And so you have symptoms of low blood sugar. And that can include your heart racing, nausea, vomiting, stomach cramping, bloating, those types of things. The other thing that carbohydrates can do is there is a diet called a FODMAP diet, FODMAP. And what we found is that there are certain bacteria in our gut that can really go to town on certain foods. So we have this symbiotic or great relationship with bacteria that are in our gut. And our bacteria in our gut really do help us extract energy from the food that we eat. And some of these bacteria do a really good job of it. And so if you are one of these unlucky people that have a particular bacteria strain in your gut, and we have zillions of these bacteria in your small bowel and in your colon, we may find that there are certain fermentable foods, so like sauerkraut, there are certain oligosaccharides, disaccharides, monosaccharides, and polyols. And what do all those have in common? Those are all carbohydrates. And what we're finding is that there are certain carbohydrates that when people eat them, it can cause increased bloating, increased abdominal pain. And so the next thing, whenever I'm kind of going through, like, what are the most common triggers for this bloating feeling, is I'm not just asking how you're eating or how it's prepared. I'll also ask, what are you eating? Because oftentimes it's the carbohydrate that you're eating and it's just doing a number on your belly. What I found is whenever patients have some of these food insensitivities, or these food sensitivities rather, like with the FODMAP diet, patients can usually reproduce those symptoms after a meal. So sometimes you might do an elimination diet where you have a list of foods that you shouldn't eat and then the list of foods that are fine. And I tell people, have everything on the fine side and only include one of the possible culprits in that meal. And you'll know within a couple of hours, if not a couple of minutes after you eat it, if it's going to cause a problem for you. It might take 15 minutes, it might take several hours, but then you slowly feel that belly raise. So for instance, I cannot really tolerate Splenda or stevia. I think it tastes great. But I used it, if I've used it in a baking, or if there's a lemonade that I really like that's sweetened with stevia, oh my God, I will be so bloated. There's even certain vitamin waters that's what they're sweetened with. And it just does a number on me. And whenever I went back and I took my own advice and I did a food log, you know what I found? The common denominator was this artificial sweetener. So sometimes it's also what you're eating. All right, so now let's take out how you're eating and what you're eating. What else could be causing these issues? Well, sometimes patients can have a little bacteria in their gut called H. pylori. Whenever you come to see me, I always perform a preoperative EGD to make sure that patients are doing well and that there's not some, I like to say, ooh, the sun is into my eyes. There's not a snake in the grass. And usually that snake in the grass could be like a Goomba or some weird mass in your stomach that might be missed had I not done a preoperative EGD before operating on you. Or, and I also do a biopsy of the lining of your stomach, and what I'm doing is I'm testing for H. pylori. If you test positive for H. pylori, you generally need a 2-week course of 2 antibiotics and an acid blocker. But I will tell you, H. pylori is becoming more and more resistant to the routine medication, so sometimes people need more than one treatment protocol. Sometimes they need it 2, maybe even 3 times. And there's even salvage medications that we might use that if you're continuing to have symptoms and you continue to test positive, it could be that you have just a very resistant strain, and so you need a different antibiotic regimen. Good morning. So it could be H. pylori. It could be that you have inflammation or ulcer disease in your stomach. And if that's the case, then probably what you need is an acid blocker, and you may need to make some dietary changes. So if you have chronic reflux disease, if you have gastritis, meaning inflammation in your stomach, if you have ulcer disease, the things that you need to stay away from will be like citrus fruit, caffeine, chocolate, especially tomato-based products. All those things can cause an exacerbation of your symptoms. So it can really cause your symptoms to go squirrely. Another thing that can cause bloating after you eat is issues with your gallbladder. Your gallbladder lives right underneath your liver, and what it does is it stores bile from and when you eat, and the bile comes from the liver, and when you eat, it squirts it into the small bowel to help you digest foods. If your gallbladder has little stones in them, and typically they're cholesterol stones, doesn't mean you have high cholesterol, it's just what they just happen to be made of. Typically they're cholesterol stones, but if you have different blood diseases, it can be old red blood cells, for lack of a better term. But if you have stones, sludge, sand, sludge and sand are just, it's another way to describe tiny stones. Or if the gallbladder is just not squeezing like it should, you can certainly have what we call postprandial bloating, meaning pain and bloating after you eat. If you find to have an issue with your gallbladder, the treatment is surgical and you would need to have it removed. Typically that's going to be a day procedure. And it's one of the most commonly performed procedures in the United States. They're very safe surgeries. What else can cause bloating? Sometimes patients can have issues with chronic constipation. It is never normal not to poop like once a week. Everybody should be going once a day, or every other day. If you're not going that often, guess what? You're going to be backed up. Even if this is how you've been all your life, I will tell you, you will be full of gas. You'll be full of gas, you will be bloated, you will be uncomfortable, and it could even increase any symptoms of reflux. It can cause vomiting. And why? Think of your gut like our toilet bowl. If nothing's going out, right, you're constipated, and then you eat, that means stuff is going to back up, just like with the toilet. You don't just keep trying to flush the little doodad thing. You try to take care of the clog. And oftentimes when you go ahead and have your take your medicine so you can use the bathroom, you might have some additional cramping because, again, you have a plug in the area, and what's happening is that your body is trying to get rid of that plug. But so it could be issues with actual gut motility that are adding to this bloating. Then, of course, there's going to be some more rarer issues to cause bloating, which are more just specific gut motility issues. Usually those begin to be defined and are also pretty rare, but that's usually long down along the laundry list. Certainly if somebody has a bowel obstruction, meaning scar tissue or something is clamping off the gut in some way, either completely or partially, that can certainly cause bloating. If somebody has scar tissue and maybe your gut is like winding and unwinding, you can have these intermittent bouts of extreme pain or bloating. So you need to be evaluated. So I feel like this is a really good laundry list of why you might be having bloating and pain after surgery. I think the very first thing that you would need to do, that I recommend you do, is you need to start taking a food log, an honest food log, because you want the symptoms to go away. It does you no good to not be completely honest with your surgeon about your diet and what you're eating and how fast you're eating, because the majority of the time that is what is causing a lot of these symptoms. So whenever I have a patient that comes in and they're having these issues, oftentimes what I'll do, I have them keep a food log. Also, depending on some of the other symptoms, I might go ahead and put them on an acid blocker. Sometimes I'll test them for H. pylori. Other times I might just go right to an EGD, depending on any other symptoms that they're telling me. If these different things have been ruled out, or if you're not having a lot of relief with an acid blocker, I'll also get an ultrasound of your gallbladder just to make sure that you don't have any biliary disease. But these are some of the different things, and sometimes it's not even in that order. It really depends on the picture that my patient has painted for me and all the constellation of symptoms that the patient is telling me about. And then I just had to put on my detective cap and kind of see where the case leads me. But I think that this is why it's important that you have good follow-up with your surgeon. I know oftentimes after surgery, patients will be following up with the surgeon's nurse practitioner. That's totally fine. They know what to look for. But I really encourage you to keep a food log. Be mindful of the food that you're eating. Check out the FODMAP diet, because it very well could be that you have sensitivities to certain foods, and then try to make a good plan with your surgeon. Okay, so I hope that this helped and kind of cleared out some of the space as to why you might be having some of these belly pains after surgery. Please share this with your friends, because I know a lot of you guys out there, you have surgery together, so they might find this info helpful too. Thanks so much.